Clinical commissioning groups are the groups who are responsible for making sure that we all receive the health and care needs that we require in our areas. We've been reviewing the policies that are in place for assisted conception services. These have been variable across Lancashire and South Cumbria. So for example, someone who lives in Morecambe Bay wouldn't be able to access the same treatment as someone who lives just a short distance away in East Lancashire. The review of the changes has allowed us to be more consistent and fair in what's offered to people at this time. Assisted conception may be a term that you've not heard of, and sometimes we think of it as being IVF, in vitro fertilisation. The reason we're talking about policy about assisted conception is it's far more than just the actual bit of IVF. People often speak about the number of cycles available. Because we feel that people are having treatment while they're having this process, we've spoken about treatment units, and this is something that's slightly different to how it's been phrased before. Everyone who is eligible to the criteria that are laid out will be eligible for one treatment unit. This is dependent on them having no living children in their couple from any previous relationships. One of the big changes that people may notice is that we've increased the age that women are eligible to receive assisted conception services. Now, across the whole of Lancashire and South Cumbria, women who are eligible between the ages of 18 to 42 will be entitled to have one treatment unit. Within the process of assisted conception, sometimes embryos, sperm or eggs are not used in that treatment unit. Within this policy now, any unused eggs, sperm or embryos will be stored for up to 2 years as part of this policy. It will be slightly different for those people who, due to perhaps requiring cancer treatment or undergoing other forms of transgender surgery, will be eligible to have eggs, sperm and embryos stored for up to 10 years. This is another change that's happened in this new policy. People who are undergoing assisted conception services, we know, really want it to be as successful as possible and ultimately end up with the birth of a child. For this to happen, the health of the woman who is having the assisted conception is really important, and there are some criteria in there. So we've looked at a number of issues to make sure that it increases the success for that one chance as much as possible, and one of these issues is weight. Female partners who are having assisted conception services will need to have a body mass index of between 19 and 30. Having their weight between this range will ensure the best possible chance of success for when they are having assisted conception services. Female same-sex couple and single women now have the same rights as heterosexual couples with regards to assisted conception services across Lancashire and South Cumbria due to this new policy. Part of the reason is to make it equitable for everyone across Lancashire and South Cumbria. Why should it matter what your address or postcode is, whether or not you're entitled to these really important services? This is absolutely not about saving money. This costs the NHS a lot of money every year, and it's the right thing for us to be spending money on. We can't spend an unlimited amount of money, however, and we have to make sure that it's done in the fairest way for the most number of people and with the greatest possible chance of success.